Rocio is a client I saw after a year. When I saw her, I greeted her affectionately and told her, "Good afternoon, Mrs. Rocio, nice to see you. How is Axel?" She changed the expression of joy to one of anguish, injected his eyes with tears and, with a broken voice she answered me, "Axel died, doctor." I froze and asked her what happened to him. As a tear rolled down her cheek, she told me, "He was very well. You met him. He was a beautiful, very intelligent Doberman dog, strong, healthy, and one day he woke up dead. He was only 5 years old. That morning when I found him cold and stiff, I couldn't believe it, my heart broke. I called his vet to ask for an explanation and did not know how to give me an answer. The vet assumed that he had poisoned himself in some way. Me with my heart in my hand, I requested an autopsy. I wanted to know what happened. I couldn't bear to think that I poisoned him in some way, that I killed him, doctor. After 3 days, communicated with me, and I was given the pathologist's report. The technical conclusion was not understood, doctor. You know I'm a brute for that, she told me. But in simple language, the pathologist told me that in my Axel's heart muscle, fat had infiltrated, and this caused arrhythmias that killed him. Finally, after giving her a hug and expressed my regret for her loss, she asked to me, "Doctor, I was able to do something? Was there any way to find out what was wrong with him?" After a pause, I replied, "Yes, Mrs. Rocio, a Holter study could be performed." Do you know what a Holter study is? Did you know that it exists for veterinary medicine and provides valuable information for diagnoses and treatments in our pets? If you are a veterinary medicine student, or pet owner, you will be interested in this video. Hello everyone, I am Dr. Jorge Banda, and in this video I am going to show you how a Holter study is performed and the applications of this test. So without further delay, we go to the heart of the problem. The dynamic ambulatory electrocardiographic recording, or Holter study, is an electrocardiogram, but with an advantage. It is of long record. How we know when we caring for a patient in a consultation room, and we do an electrocardiogram. Registration times are always short. Currently, we use records of at least 5 minutes, and if we can do more. A few years ago, when we were all using the equipment, using thermosensitive paper, we even recorded less time, because thermosensitive paper limited us. Records of at least 5 minutes are currently used. To more, but those times of 5 minutes, 6 minutes, 7 minutes, 10 minutes are shorts. Many times, they are not representative of my patient's cardiac, electrical activity. And therefore with this short record I can't gather information useful for patient diagnosis and management. In simple words, in the electrocardiogram we performed in consultation, which is short-lived, often the patient doesn't show me any alterations that are useful to me for diagnosis and subsequent treatment. Then that void, Holter, comes to cover it up. The Holter study is a long electrocardiographic register, allows us to record cardiac electrical activity 24 or 48 hours as needed. This allows us to reach a series of conclusions and make many decisions with respect to the patient's hemodynamic status and its treatment, if required. As the best way to learn is through practice. Here I present Buddy, a 9-year-old dog. That will help us to show you how Holter equipment is positioned and subsequently the reading his record. For the placement of suction cups should be shaved and cleaned in a neat manner, both sides of the thorax, because with hair, there is no good contact between the electrodes and the patient's skin. Electrodes must be placed, as indicated by the technique. We ask that they bother the patient as little as possible. We then confirm that there is good contact between the electrodes and skin and that the equipment is already carrying out the recording of cardiac electrical activity of the patient. Finally, with some wit, wearing bandages and surgical clothing, we attach the equipment to the patient's body. I need it to be as comfortable as possible. Once the equipment has been removed from the patient's body, we connect the equipment to the computer, and we go to its software, to its program, which is this one here. We open it in this registry, for example. There is already a result because I have already done the analysis and I have 88.7% normal cycles. There are ventricular extrasystoles, 11.2%, supraventricular 0.1%. Let's go to the classification of the ventriculars extrasystoles. Look, the patient for many stages of registration presented this ventricular extrasystoles in bigeminate rhythm during many stages of the record. The patient presents these ventricular extrasystoles very often. There were paroxysms, I remember. Very few, I think there were 2 in the whole record. And basically this featured this one as the main, the most frequent event in the record. Ventricular extrasystoles in bigeminate rhythm. As you see, every extrasystoles is assigned a letter V from ventricular extrasystole. That is a ventricular beat, is a ventricular ectopic beat, a ventricular extrasystole. And I would like to tell you that many of these extrasystoles, the program didn't count them as extrasystoles. It counted them as normal bites. So, we should not rely on what the program tells us. We have to count down minute by minute. And therefore, we are going to work hard, because this work is heavy. Hard work. Here I have the minute-by-minute record, or continue record, and in this part, I made the classification of all ventricular beats. For example, here I have a sinus tachycardia, and then there is a stage of ventricular extrasystoles in bigeminate rhythm. Then this patient had very frequent major ventricular arrhythmias. That is why we started an antiarrhythmic treatment, and the patient improved very much. The patient responded well. As we see, is the Holter study the tool that allows us to, in this case, decide on antiarrhythmic treatment, and even decide on which antiarrhythmic we can use. Well, when is a Holter study indicated? The Holter study is indicated for the assessment of arrhythmias. As we have already seen, electrocardiograms in consultation are often not representative. The Holter study is also indicated for the valuation of antiarrhythmic treatments. How can I know if a patient is responding well or not to antiarrhythmic therapy? We should do it through a Holter study. Syncope. In all those patients who go through syncope, suffering from syncope oring, per diagnostic protocol, should always doing a Holter study with them is also indicated in all those patients who suffer from familial cardiomyopathy, as we saw in the sad Axel case that we presented at the beginning of the video. He was a Doberman puppy, and we know that the Doberman and Boxer breed are overrepresented for cardiomyopathies and the arrhythmias associated with these cardiomyopathies. Therefore, any dog of these breeds or its sons, we have to do a Holter study with them very frequently. And finally, all those patients who have an implanted pacemaker Logically, we have to do a Holter study with them very frequently too, as in people. Well, the conclusion is that the Holter study is an extremely useful tool to approach hemodynamic status of a given patient and make decisions regarding their therapy, mainly antiarrhythmic therapy. As you can see, is a feasible test to perform. Although laborious, it can be performed. So I invite you to explore it a little more, because it is certainly a little used test yet. Finally, I hope you have found this information useful, and that I ask you please to share it with the greatest number of people as possible, vets, veterinary medicine students, pet owners, to learn a little more about this test, and can be requested from their trusted cardiologist to vets and veterinary medicine students who wish to do so. If you like, in the comments, put the word bibliography and I'm going to share it with you. Please give the video a good like. And until next time.